Welcome. Please tell me who you are and why you're here.
Hi, my name is George Khalil, and I am a researcher in health communication at the MD Anderson Cancer Center in Houston, Texas, and I'm also a PhD student at the University at Buffalo, New York. I'm here because the Games for Health conference is basically the hub of all professionals in Games for Health, and not only in Europe, but from many countries that come to connect and collaborate and share with each other not only games, but ways to improve games and make games better for public health and health promotion.
And why are games for health, or serious games, or applied games, as they're also called, an interesting field to be in?
Of course. Well, as we know, games are they are reactions to it. They are interventions that can create the world of play for people, and play is very important for people to have in their life. And when they experience play, they are able to experience positive psychology, and they are able to create a world in which they can become intrinsically motivated from the inside, motivated to change their health overall. And as we know, games as part of entertainment also give the opportunity for people to, and players specifically, of course, to experience their life through games, so that they know how reality will be when they leave the game, and so they learn lessons so that they do not make mistakes in their everyday life.
But would they not rather just take medicine, because that's easier?
Well, of course, games are not only for patients, but they're also for healthy individuals, so that they can make sure that they don't have the disease later on, so that they can prevent it from the very start. And we call this primary prevention. And that's very important for anyone to play games for public health, not only if they have a health problem. Instead of waiting for the health problem to happen, maybe we can start playing first and then making sure that we don't arrive to sickness.
Yeah. When this is so important, why aren't games prescribed by doctors, or why don't the government gives us all sorts of games so we can practice and prevent ourselves from becoming ill?
This is an absolutely great question. The reality is that doctors have begun to prescribe them. They are not officially prescribed as part of their routine professional life, but we are getting closer to the day when technology and entertainment technology will become part of medicine and the healthcare system, and where prevention will become a very important piece of the puzzle in public health overall.
Yeah. So you think it's going this direction?
We are going at this direction.
Yeah.
We are far, but we are getting there. It is a hard innovation to adopt by the healthcare professionals. It is a matter of disseminating it, marketing games to the professionals, and giving them the opportunity to see the effectiveness of these methods of games for health by evaluations, which is very important, especially in my field, validation and evaluation, to not only show that a game is overall working, but also show what's inside the game that is responsible for the change and the health outcome. And by choosing by identifying the changes in the game, we can not only be able to give the health professional a concrete proof or explanation for why the game works, but also allow the designers to improve the game and make it stronger and better for the future.
Yes. You work in the United States of America.
Yes, I do.
When I look at over there, especially when I look at investments over there, a lot of money seems to be invested into serious games at this moment. Does that mean the serious games are taken much more seriously over there than here?
I do not necessarily think so. I think it's a matter of sites and organizations. The importance of serious games to be taken seriously is not by the quantity of projects done with serious games, but the quality of the product. So while there may be many serious games in the United States funded projects for serious games, many could be not well done or need improvement, while there may be few serious games in Europe, but they may be well scientifically done and well designed that they are more effective. So we cannot answer this question by the quantity or by evaluation.
We need to look at the quality of games. And if you look at quality, are there good games made over here in Europe?
Absolutely.
Yeah.
Absolutely. Several games that have been presented in this conference, many of them are effective and have shown effectiveness. Some that use augmented reality to help young patients in pediatric hospitals, for example, to get distracted and not have pain while surgery is happening or while drawing blood, so that they do not start crying and feel pain. And that was a very effective game because it was evaluated and shown effectiveness. Also others, such as some applications, mobile phone applications, have been also evaluated and studies that have been designed here in Europe and have shown effectiveness. So as long as we test the games that we design, we should feel comfortable about their effectiveness or comfortable about the need to improve them. And that will help us answer the questions regardless of what country we're in.
Yeah, a lot of developers talk about the fact that once they have finished the game and they want to validate it, because that's important, that the validation takes such a long time.
That's a very important comment, because it's actually, I believe it's a misconception by developers. The reality is that it depends on the study that we are doing to evaluate them. It depends on the questions we are asking and the hypothesis we are putting together and to test. And if we study these hypotheses in different ways, we can answer different questions that could take 1 year, 2 years, or even only 6 months or less. So it depends on what we are trying to ask. And if we want mini evaluations, phase 1 trials versus phase 2 or phase 3 trials, so we're doing smaller studies, we can still do that and still have results that are good enough to be confident about the game that we develop or design. So it's all about the question that we ask.
Yeah. So other criticism I hear talking to people is, especially developers, they say once a game needs to be validated, well, you lose a lot because it has to be simplified. You can't have it all. You can't have all the whole spectrum, because then the validation is too difficult.
And in this case, this is when smaller experimental studies can be done to evaluate it without changing anything in the game, but by studying direct effects of the game on the player's emotions, frustration in the game, ability to use the game. So we study usability and things that do not need to show a complete behavior change, but at least tell us the health psychology. So tell us if they change the way they think about the health issue and if they are motivated to change, but without necessarily capturing behavior. And also games, as you are saying, they are very dynamic and complex and they have many features.
Yes.
So another way of studying them, also in a small studies that do not take too long, is by manipulating the game, the inside of the game, and creating conditions and putting different groups of players in different conditions. Some conditions have certain features, some don't have the certain feature, and we may be able to tell if that feature was important or not. And this way we isolate a certain feature to test it.
So you're quite positive.
I am.
Yeah.
I am very positive about this.
You don't see any trouble or problems ahead of us?
I think that finance is the biggest problem.
Yeah.
Funding is what is the energy other than our own ambitions. Funding is a big energy in driving the progress for games for health. And I believe that this can be very well challenged and resolved with collaborations and connections between people, especially through this great conference, because people will get the chance to discuss weaknesses and strengths that they have, and then they can complement each other. And this way, they can help each other with resources, even tangible and concrete resources, even if it's funding, to create something that is of mutual interest to everyone and end up with a successful game.
So joint strengths.
Joint strength.
Yeah.
This is the best way to fight this challenge.
Okay. Thank you very much.
Thank you so much.